After a fabulous talk, probably the best of the meeting this time, I invite Dr. Mangesh Patil. How to convince your hospital to buy a robotic setup or any major equipment.
A very good morning, everyone. Thank you, team MPH, SI sir, and Arvind, to involve me. I'll be talking to a very sensitive topic. Probably everyone is, when they are going through the residency, I'm sure everyone is now going through or having some touch with the robot. And still, many people, the residents or the young urologists going to second tier cities, they may not have a robot. So the question comes, how do we convince or how do we put it to the management to get a robot? Because it's a big elephant. Individual cannot afford to buy a robot. So an institute or a hospital probably will be the right place to have a robot. So let's see what how do we uh, probably have some points or discussions. How do we convince the uh, management? So the talk I will be under the headings that introduction, market analysis, cost benefits, uh, patient outcomes, implementation strategies, and the most important will be addressing concerns from administration and how do we act on it. So, as everyone knows, and I'm sure most of you have worked somewhere with the Association of the Robot, and probably it started in somewhere in 1990s, 2000, where Dr. Gill, Dr. Menon started the robotic surgeries all over the world. It spread like a wildfire, and probably 2010 it touched India as well. And 10 years down the line, we can see many hospitals, probably more than 100 robots all over India. They are doing reasonable well work. So it is definitely adding to the precision, accuracy, and the minimal invasion is giving the better results to the patients. So basically, the robot itself gives advantages to the patient, surgeon, as well as the hospital. Now the question is how to involve the hospitals to get more robots or make it more fruitful. So to the patient, advantages are, as everyone knows, the minimal invasion causes more precision, accuracy, and definitely better results. So they can resume early. To the surgeon, definitely the ergonomic design gives a better physical working environment. So the physical burnout to the surgeon is less, and of course to the hospital it gives it being a new tool and more accuracy. It attracts more patients, particularly those who are keen for minimal invasion with less complications. So when we do the look at the demands in India, we see the statistics, all the cancer incidents, the number of cancer patients are increasing. Every year the number is going up. So the need of surgical intervention is more. Most of these surgeries are curative surgeries, and from open to laparoscopy and from laparoscopy to robot. So the current trend is the patients are increasingly demanding for minimal invasion, and technological advancements are there. So naturally, the robotic or laparoscopy surgeries are on the increase. Now, if we compare globally, the definitely India has a rise in requirement of the minimal invasive tools, but still we are lagging behind the Western world, and probably we may be able to touch the numbers. So when we see a robotic instrument being installed in one institute, the surrounding institutes start, they look it at like a competitor. So when we analyze this, so those who have got the robots in the initial phase, they have definitely done well, and they became the leaders of the minimal invasive surgeries. Though it is laparoscopy or a robot, the the advantage they got is definitely bigger. Like you take an example of even MPUH, even Kokulaben, even at our place, Sir HN Reliance, we are doing regularly robotic surgeries, and it becomes a tertiary referral unit. So hospitals which are like in initial phase, they definitely got an advantage, and of course there the competitors start considering about getting a robot. But when it comes to implementing in the hospital, we have to have some cost analysis or cost benefit analysis, and there comes the actual question, like whether it is worth investing in that robot. So uh, when we look at it, the initial investment, we we have three challenges: the equipment cost, the training cost or maintenance cost, and the facility modification. So when we are considering equipment cost, it is usually the investment between 10 to 20 crores. For an individual or for a smaller nursing home, it is still a bigger amount. Definitely, there are Indian robots coming with SSI Mantra, and there are other which are offering the robots in somewhere around 5 crore, and they are trying to equate whatever the monopoly of Intuitive or Da Vinci. But yes, that potential return of investment has to be considered, and of course, when we talk about the investment, it is not only financial investment, but the training of the surgeons as well as the staff. That is also needed. And of course, there are certain facility modifications, like the probably a bigger operation room, or the instruments or equipments, maybe better cauteries or better instruments will be required. So those points also need to be considered, and that comes along with the robot. So are there really long-term benefits with the robot? Yes. So what happens is, when we have a new technology with us, definitely it attracts few pluses and minuses. So the pluses or the positives of this are the volume of number of patient increases. As the number of surgeries, number of patients requiring these oncological cases, the the robotic surgery is more and more demanded by the patient. So naturally, if any hospital has a robot in any area, nearby the same place or the nearby places will start demanding, the patient will start coming. So that definitely increases. Definitely it increases the revenue in terms of number of patients. So as the number of patients goes up, and most of them are well-to-do or financially stable patients, so naturally the revenue generations to the hospital are more, and as the complications are less, naturally the turnover time is less. The patient number of patients are being treated more, and small stay and more revenue generating kind of model. So definitely it helps in generating more revenue, and definitely when we consider patient outcomes, it has a smaller hospital stay, so naturally recovery times are faster, the surgical success rates are better, and patient satisfactions are higher. So and of course the risks are lesser, and of course the complications are less. So naturally the safety to the patients is more. Now coming to the very important point where we are implementing this. When you are, all of you, probably the residents or the new doctors, young doctors, will go to the respective places, they may have this point now, which is very important for you to convince, or you yourself has to get convinced that the robot probably is better than any other tool, and then only you will be able to convince. So whenever you talk to the management, probably there are 3 points we need to get convinced and talk to them. That one is a budget allocation, second is a timeline development, and third is a stakeholder involvement. So few of you may be the hospital owner, few of you may be the consultants working. So every instrument like a robot, has its own budget. So we have to have a certain amount in mind which we need to convince to the hospital that probably 10 to 20 crore, and how it will be. So that is known as ROI, how an ROI will work. The timelines also have to be convinced to the hospital that how many number of cases in a year or in months which will convert this into a financially viable model. And who are the stakeholders in this? Stakeholders are the people who are the pillars. One will be a surgeon or the operating person, the second will be a team, and third will be the patient. So three of these, if they are convinced, probably the hospital management, it's easy for the hospital management to be convinced. So very important will be training your team. Now coming to the concerns, so addressing concerns, the important are the financial concerns, the training concerns, and technology adoption. So as I said, the cost that has to be convinced, the maintenance cost every year, annual maintenance cost, and of course the consumables. The cost has to be convinced. Then comes the training to the staff, surgeons, as well as the support staff. Now, there are skilled works like MPUH has a training center. So such places can develop into good surgeons and a good team, which again can go to tertiary centers or the second tier cities to establish newer hospitals. And of course, technology adoption as per the requirement. And how do we mitigate these strategies? So first is providing financial projections. So the cost.
Last 1 minute.
So the detailed cost benefit analysis has to be explained. The investment models have to be understood. The projection, the number of cases, and of course different options like government subsidiaries and healthcare financial options or the CSR partnership. Offering comprehensive training centers. Of course, the training centers like MPH or the other centers can take over the newer surgeons to develop into training centers, and of course demonstrating return of interest. So usually it is 3 to 4 years which is required for the break even of the cost, and after that probably they start making profit. So coming to conclusion, I'll just read out the final what I feel and what I have gathered is to move forward we have to have a feasibility study how the working of the robot will work. The pilot programs have to be devised, brainstorm with other leading institutes, has to be compared, and of course engaging the stakeholders and commitment to the innovation. So we are looking at positioning the hospital as a leading hospital everywhere.
Thank you, Mangesh.
Thank you so much.
Thank you.
No time for a question. How many cases in a month we need to be around? So usually the studies show 20. How many cases in a year? In a year, so to become financially viable, it should be 15 to 20 per month. 15 to 20 per month, and then second year it becomes like 30 per month. So that's how. So maybe every day 1 or 2 cases. Does insurance cover all? Not all insurances, but nowadays the more insurance companies are coming up with coverage.
See, the challenge is that you need to have that number of cases, and that number of patients have to pay that much. See, patients are there, but of this 100 patients, how many percent will pay that much for the robot becomes a challenge. And therefore, to have the single specialty viability of a robot becomes challenging. If you have multiple people doing it, we have so many examples in the country that it is not only viable, they have purchased second robot. That means it is definitely viable. But if the robot, one specialty, how many cases you will get continuously, 20 cases per month, continuously keep on getting, who will pay that much becomes a challenge, because yours is not the only center where robot is having. There are other 10 robots which are being installed at different places, and everybody is going to make efforts to get the patients for robotic surgery. But if that particular robot, today it is used by urology, tomorrow by gynec, tomorrow by general surgeon, this, that. then collectively it becomes very much viable. That is the whole thing.
Multi-specialty involved.
Yeah. Thank you very much for the nice talk.